Okay, Desiree Green-Harding, please come up. So Desiree is living and working in Ohio at the Bon Secours Hospital in Cincinnati, and you've been able to fashion a clinical rotations program for yourself outside of Illinois. So you're the first psychologist who will be prescribing in Illinois, who is doing her rotations outside of the state. So I'd love you to talk about how you did that.
I wasn't expecting such special recognition.
Yes, of course.
Oh, sorry. So I'm a psychologist in Cincinnati, and I work primarily in medical settings right now, working in oncology, and then I do consults in the general medical setting as well. So I started this journey because I had a lot of physicians coming to me with limited psychiatry services as the mental health specialist, and they needed and wanted guidance in terms of what to do with people's psychotropic medications. So that's what started me on this journey. I completed my MSCP in October of 2022 with all intentions of moving to Illinois and doing my medical rotations here. However, upon telling my employer of my plan of doing this, they were like, please, we don't want to lose you. What can we do to make this work? We're going to create this program for you. So I had to put some work in finding all of my preceptors for these various rotations. But honestly, everybody has been amazing, very receptive. My employer is willing to help me pay the money to get this program approved in the state of Illinois. And really all the preceptors, they've welcomed me. They actually love having a behavioral health person there. And the hardest part was finding a psychiatry preceptor. However, there was one psychiatrist in our system who I'm forever grateful for. He was a wonderful teacher, and he was willing to let me work with him. So I will say I am a better psychologist for this training that I've done, and highly suggest that if you don't know what to do with this degree and you're in a state where you're not able to prescribe, to at least just start taking steps forward, and you have no idea what kinds of doors are going to open along the way.
Yeah, please.
So
Yes.
when you complete this, you'll hopefully be licensed to prescribe in Illinois, but you're practicing in Ohio. So what happens?
Yes, I anticipate on maybe doing some telehealth work in Illinois, but I am on the task force in Ohio for prescriptive privileges. And I decided to pursue the option of the medical rotations in Ohio because I thought this would be a great opportunity to help physicians learn about prescribing psychologists. Nobody that I've worked with had heard of a prescribing psychologist. So I think it's a great opportunity for me to develop relationships and spread the word and hopefully get things moving in Ohio. But in the meantime, I'm having my Illinois license.
Yeah, and I think it's remarkable. So our licensing board does pre-approvals of rotation sequences. And so your hospital, Bon Secours in Cincinnati, has said that they will pay that to be approved by our Illinois licensing board for the rotations that they're giving to Desiree so that she can be licensed here. So that's a remarkable move.
I will also say Mercy Health is the largest healthcare provider in Ohio. So to me, it was also a great opportunity to get this organization on board.
Yeah.
To see what that could do. And they're also in other states as well. So
That's really unique and remarkable. So thank you so much for being a pioneer in another state. Thank you.
thank you.
Thank you so much.